Hello, I'm Dobbin Chow. I'm the program director for the internal medicine and the transitional year residency programs here at University of Maryland Midtown Campus. Welcome. I want to thank you for your interest. I realize this is a challenging and difficult and unique year for applying for residency program. To help you in that process, what we thought we would do is to introduce you to some of our faculty. Because all of our interviews are going to be virtual, I was worried that applicants would not have the opportunity to get a sense for our faculty, and so we had our very industrious and diligent chief resident go and interview several of our faculty to give you a sense for them and what their perspectives were related to their role as a faculty member and their views and insights about our residency program. If this was, if we were not in the middle of this pandemic, you would be able to come meet faculty, meet our residents, get a sense for the culture and the training environment here, and a true flavor for what being a resident here is like. Unfortunately, that opportunity does not exist, and so we're going to try and do our best through these different videos and through your interview process to give you some insights into the sense of community, the collegiality, the training environment that you would experience if you were a resident here. So, hope you enjoyed this video. Thanks again for your interest in training here and for considering our program as a site of your future residency training.
Hello everyone, I'd like to introduce myself. I'm Dr. Saverio Maracci. I am the Deputy Chief Medical Officer here at the University of Maryland Medical Center Midtown Campus, and I want to welcome you to our beautiful campus and tell you a little bit about who we are and what we do here and why you should consider the University of Maryland Midtown Campus for your training. I'll start off by telling you that we are located in Baltimore City. We are an urban campus, but we also serve a diverse population here, primarily inner city patients with a variety of disease conditions. But we also have a referral base from outside of the city where we see patients who are referred into our institution. And we also see a lot of patients from the routine all the way up to our intensive care unit. And we have a intensive care unit, which includes a neurocritical care unit here at the University of Maryland Midtown Campus. So we feel that we have a lot to offer the house officers that train in our program. We also, of course, have an ambulatory component to our training. And I also want to mention that we are very closely aligned with the downtown campus, which offers opportunities for electives and subspecialty as well as research opportunities. Finally, I'd like to say that the house officers here have a very diverse training from electives to surgery to acute care as well as outpatient care, and that we rotate on multiple teams here at the University of Maryland with faculty attendings from the University of Maryland Medical Center. We have our daily IDR rounds where I get to meet many of the residents and the house officers, where we discuss all of our patients and particularly their needs around discharge planning. And these rounds happen 5 days a week and are abbreviated on the weekends. And we certainly find that they help us to reduce our length of stay as well as our readmission rates at the University of Maryland Medical Center. And it also gives the house officers insight into the social determinants of health that many of our patients face these days. And it makes it a challenge for their discharge, or I should say a barrier to discharge. So for all those reasons, I believe that the University of Maryland Medical Center Midtown Campus offers a unique opportunity for a broad-based education in modern healthcare. Thank you very much.
Hi, I'm Dr. Schwartz. I'm one of the 6 or 7 hospitalists here at University of Maryland Medical Center Midtown Campus. And there are several hospitalists here that have backgrounds in various specialties such as nephrology, cardiology, and infectious disease. My background is in primary care, geriatrics, palliative care, and psychiatry. We have several teams that you would rotate through. One is the gold team, which I'm covering now, which is general med-surg inpatient. We also have what's called a purple team that tends to get more infectious disease patients. We have an intensive care unit and a kind of a step-down, lesser acute intensive care unit team. And then we have a blue team that we refer to as the non-teaching team, but with a community medicine physician. The patient mix here is quite distinctive. We see an awful lot of patients who are have significant psychosocial stressors. So we have a very robust substance abuse program. The services here in Baltimore for this community are very extensive. So you have many resources at your disposal. A 24-hour substance abuse service team. We have lots of patients with renal failure and quite a few very involved nephrologists. We have our share of cardiovascular, pulmonary, diabetic patients. We do have a full endocrinology consultant team. We are also servicing quite a few surgical specialties, which predominantly podiatry, orthopedics, vascular surgery, and neurosurgery. So I will tell you that this is the best hospital I have ever worked in, and I've been practicing medicine for going on 35 years. The quality of care here is quite high. The quality of the residents is very high and significant. We do get medical students, and so there's a fair amount of teaching going on all the time. The residents are first rate. They are learning at a very rapid curve when they come in, and by the time they finish, I would be proud to call any of them my peer. Certainly on the hospitalist services, you will get prepared to do hospitalist medicine, which I would recommend. It's a field that I love. In addition to scoring very well on tests and things like that, I will say that the residents here get along with one another very well. There's a spirit of camaraderie here that is second to none. We have fun, we enjoy the work, everybody works very hard and works very well together. I attribute most of this to Dr. Chow, who's the residency director. He creates an environment that is extremely supportive, educational, friendly. It is not a competitive or critical environment. He's probably one of the best internists that I've ever worked with as well, does a lot of teaching. Lots and lots of teachings. Residents have conferences every day. They get fed. So all those good things. They have nice call rooms. What else can I say about the residents? I have just thoroughly enjoyed teaching here. We have sometimes rounds that go on for a long time because we're trying to teach the medical students. The residents are very involved in working with the medical students as well. And I would say that one thing about this hospital that I found very refreshing is that everybody is very open and tolerant of our rather difficult patient population. And I think part of that is because we have excellent resources to help folks. It is a downtown population. In Baltimore, folks are subject to trauma, homelessness, and isolation, social isolation. We have excellent psychiatry, behavioral health services that helps us to deal with each patient as an individual. And also because you're practicing in Maryland, there's a very rational and sensible focus on appropriate utilization of resources, and that's why part of the UMMC outpatient world is so well resourced. So it's a system that I think is quite rational. We don't, it's not a corporate type situation. It's not driven by profit. It's driven by patient quality care and education. So that's what makes this a great program. Thank you.
Hi, my name is Asim Sood. I am a hospitalist here at University of Maryland Medical Center Midtown Campus. I am also a former chief resident who graduated from this program. I serve on the faculty at University of Maryland School of Medicine. I wanted to tell you a little bit about our hospitalist program, specifically how we interact with the residency program here. So we have a team of 8 academic hospitalists who are all faculty at the school. I would say that we spend more time directly on rotation with the residents than probably any other specialty. We are on your rotations on the medical wards, as well as in the IMC unit, and we operate a night service for admissions that are coming from the emergency department into the hospital overnight that we staff with the residents. I would say in my experience here, the main attribute of the residency program that jumps out at me is that we are blessed to have a happy house staff. I think there is a family environment fostered by our program director, Dr. Chow, that leads to this being a pleasant place for all of us to work. I would encourage all of you in your search for a program that fits your needs to try to assess if the non-medical side of it also matches what you're looking for. And here, I would say most of us appreciate the friendly community hospital atmosphere. In terms of resources, we are lucky to have the same faculty at both downtown and midtown campuses. So we have access to the same group of subspecialists that rotate through our hospital. I would also say that most of our hospitalists have had some experience as alumni of this program, which is a bit unusual, I think, if you look across the country. And most of us are very happy to see the progression each year in our house staff. If you have an interest in acute inpatient medicine, we are happy to be mentors to you. And if you are in a stage of development looking for research or quality improvement projects, we are also happy to work with you closely. I would tell you the best of luck for your search for a program that fits your needs. We appreciate your interest in our program in particular. And hopefully you find the program that's right for you. Please feel free to reach out to us with any questions you might have. And thank you very much for your time and interest.
Hi, I'm Dr. Sama. I'm one of the 2 medicine attendants that you will be working with when you get to work on the Purple team. Now, while here at Midtown, you will have 2 main medicine teams that you're going to work with. You're going to do your core rotations either on the Gold team or you're going to do them at on the Purple team. You will also have plenty of opportunity to work at the IMC and also see more acute patients in the ICU. The one great thing about being on Midtown is that you see a diverse patient population. We are a typical inner city hospital, so we see everything from drug abuse with many complications. We see a lot of infections. We see a bread and butter COPD cases, heart failure cases. But in addition to that, we also get a lot of transfers from some of the community hospitals in the outskirts of Maryland. So you really will get an opportunity to see many diverse patients. So it's really been a pleasure, and it's been wonderful working with the residents here. I think they are very hardworking. I think they're very smart. Over the past few years, we have successfully matched residents into some of the more competitive specialties in internal medicine, like gastroenterology and cardiology. But in addition to that, our residents are also very innovative. They're always, they're implementing, trying to implement new technology into improving our care of our patients. One of our residents, Dr. Shuba, is currently, working on implementing bedside ultrasound into our curriculum. And so if you come here, you really will have an opportunity to get a very complete and generalized education.
Hello, I'm Jeff Gerbino. I am the Assistant Program Director for Ambulatory Medicine. So I will be the main person in charge of your ambulatory education when it comes to your continuity clinic over the next 3 years. I have a passion for primary care. I completed a primary care track during my residency, so I'm excited to kind of get other people excited in primary care. So we can expect at the Midtown Health Center, where our continuity clinic is, we see all different types of patients. We see a lot of patients with the bread and butter internal medicine, chronic conditions, diabetes, high blood pressure, kidney disease, COPD. We see some acute problems that you would expect to see in primary care. And we also follow up on a lot of the inpatient admissions. They'll follow up with us in a certain period of time after hospital. As part of your continuity clinic rotation, we're not on an X plus Y system, so each week you have a day, an afternoon, where you'd come in and see your own patients on certain rotations. And depending on what year, you'll see up to 3 to 6 patients per session. You'll progress as you go along. Also, each day you're in continuity clinic, we do like to do before clinic some sort of didactic educational session. We'll go over some set curriculum. Sometimes we'll go over just some topics that may be pertinent to that clinic day or what's going on in clinic. And it's been, I've been here since January of this year. I really enjoy working with the residents. They have been great so far. It's been a good opportunity for me, and I feel like they've responded to some of the teaching and some of the things that we're trying to do in clinic to really increase the continuity of the patients with the resident as their PCP, and really try to focus on trying to do a little bit more for patients in the primary care setting, rather than referring a lot of people. But at the same time, because we're part of the university system, we have access to refer to multiple subspecialties, which comes in handy. We don't have to wait very long. If we need to get somebody into cardiology, we can typically get them in pretty quickly, or other subspecialties. So that's the nice thing about working for a big university system. So for those of you that are interested in primary care, and also those that are interested in specialty care, there are a variety of outpatient subspecialty clinics that you can rotate through, which I know during my residency I found really valuable in terms of preparing for a career in primary care. But even for those that are doing subspecialty, a lot of the care that actually takes place in the subspecialties, most of it doesn't take place in the hospital. So it's important to see kind of what the outpatient experiences in those subspecialties, and getting a feel for what those clinics look like kind of gives you a good idea of, what's appropriate to refer, when should I refer, how much can I work up in primary care before I have to refer. And for those of you that do have some interest in primary care, I think those experiences are very valuable. And I've already, in my short career, I've worked for a couple of different types of practices, so I have kind of a little bit of experience of how different practices work, and can always share that insight with you if you have some interest in primary care. So I'm excited to be here at Midtown, and I think my experience so far has been excellent, and I hope you will share that enthusiasm and come join us here in the Midtown community.
Hello, my name is Marjorie Pennant. I'm an assistant professor of medicine at the University of Maryland School of Medicine. I've been working with the Midtown residents for about 12 years at the Midtown campus. We also have our Center for Diabetes and Endocrinology located at the Midtown campus. At the Midtown campus, we see a vast variety of endocrine disorders. We manage patients with diabetes mellitus, obesity, pituitary dysfunction, thyroid disorder, and metabolic bone disease. I love working with the residents at the Midtown campus because I find them very hardworking and enthusiastic. For those who are interested in pursuing an endocrinology fellowship, there is a mandatory 1-month rotation at the Midtown campus in endocrinology. You can also pursue to do an elective at the main campus in endocrinology, where you will work with other faculty members in the Department of Endocrinology and Metabolism. I wish you guys the best of luck in your search for a residency program.
Hi, my name's Patrick Ruscavage. I'm infectious disease provider, and I'm the chief of infectious disease at Midtown Campus. I was going to give a quick overview of our infectious disease service and what you can kind of expect to see if you were to rotate and do residency here. So I find this infectious disease service that I consult on up here to be very rewarding and diverse. So we see what may make this service somewhat unique is we have a very strong orthopedic and soft tissue kind of infectious disease service. We see a lot of patients coming in with consequences of intravenous drug use, endocarditis, soft tissue infections, joint infections, a lot of podiatric infections, diabetic foot ulcers. But then in addition, we have this wide spectrum of pathology that just comes in from the community. We see a lot of traditional kind of general infectious disease, ventilator-associated pneumonias, community-associated pneumonias, CNS infections, a pretty wide spectrum. In addition, just for people rotating with our service, we have a 5 North post-acute service that is event weaning and long-term chronic care facility that takes care of patients with a lot of kind of complicated multi-drug resistant bacteria. So we get a chance to flex our infectious disease muscles up there, and a lot of interesting antibiotic regimens emerge from that. Outside of the inpatient area at Midtown, we also have our HIV and infectious disease clinic here on the Midtown campus that serves our entire university. It's called the Thrive program, and have close to 3,000 patients in that, several opportunities to rotate through many of the different aspects of our clinic, including HIV care, hepatitis, general infectious disease, and several others. We are always excited to work with residents in clinic, and I think it's a unique kind of training opportunity here to be so close to one of the bigger HIV clinics that you'll find in the country. For residents, we love working with the Midtown residents. We find them to be just incredibly enthusiastic, smart, and really lots of opportunities to get involved in research, clinical projects, QI projects. Our goal as faculty up here is to foster mentorship when residents are interested in potentially going through down the ID track, or they're going through a different track and they just want to bulk up their ID knowledge. There's different forms of mentorship that we can provide, clinical mentorship and research mentorship and others. We really look forward to the new crop of residents that come in, because they all have a really kind of wide range of experience and interests, and love working with residents from all walks of life, particularly those who are interested in ID. But so we hope that we get a chance to work together, and that's it, I guess.
I hope that you enjoyed this video. I hope that you had a chance to have a virtual handshake with some of our faculty, get a sense for them and their insights, their perspectives on the training program here. It's one way that we're trying to convey the feel for our program here. I hope that after your interview, after your visit, that you'll continue to consider University of Maryland Midtown Campus as the site of your future training. Thank you.